Next question. That
It was more.
I'd have to look at the question. I've made so many exams. I've got the nurse, the PN, the RN. There's all different types. What I'm saying, anybody who wants to go ahead and review those exams, I am more than willing to do it. Okay. So we're going to do the Kahoots and we'll be done. What I'm going to do is find the recording from last quarter. It is chapter 21. You do have the PowerPoint to go over it, but I did get a lot of input into this Kahoots, those concepts that you need. So, and I'm going to teach over the Kahoots. I'm going to give information all about the areas that we're talking about.
You say we'll find out our grade tomorrow morning?
Tomorrow about noon.
Okay.
You're lucky you're a Friday class. How about those students who had Monday and they have to wait? And we can't give grades out until they're done.
Yeah.
But I'm letting you all know, you all did really well, and an 80 on this exam is amazing. Anything more than that is gravy. And most of you are above that.
Sweet.
So, good job. All right, let me get going. And let's look at what's going on. So we know that this week we have some stuff that is due. We have, where did I put it? Your discussion question, and that's all you have due this week. I noticed most of you were able to do your initial post. Just make sure they get done and that you do respond to them. And then I'll be scoring your discussion questions tomorrow, and all of those will be done too. So let's get going. So week 4, chapter 21, but it's a lot of different things in that chapter. Which child would have the most difficulty in coping with separation from the parents? Separation anxiety, right? So we know what the 3 stages are. They cry and then they sort of regress and then they are indifferent to the parents. So, but who's the hardest kid that really doesn't want mommy or daddy to leave? And that's your toddlers and your cognitively delayed children, your Downs children, okay? Your autistic children. But overall, globally, toddlers want mom and dad there. They have a hard time without them. How can we decrease the stress and anxiety of a 2-year-old that's hospitalized? Well, first of all, toddler, we want mom and dad there, right? That's the first thing. But besides that, if we keep them on their same schedule as home, and if possible and allowed the same sort of food choices, this kid is a lot happier. You change the food, you change your schedule, and these kids are confused and they don't like it. So try to maintain the same and have parents there. And these kids actually do pretty good in the hospital with that. That's the first thing.
Professor, I'm going to sit out on this Kahoot.
Okay.
Thank you.
Dramatic play has the child draw a picture about scary hospital procedures. Why would you do that? Why would you want to know a scary hospital procedure? Dramatic play. We know parallel play, associative play, cooperative play, right? We know all of those things. But dramatic play. Well, sometimes you have children, especially those who are repeat admissions. Example, a child with sickle cell crisis, right? They're in and out of the hospital. Things sometimes happen. And depending on the age, sometimes they can't tell you what was it that scared them. But kids draw pictures and then they can describe them so that we can help them. Tell them the scary, take the scary out of scary, right? A 2-year-old child has been crying constantly for his mother since he was hospitalized 3 days ago. What is this behavior? Separation anxiety. And 2-year-old, again, toddler, doesn't like to be without mom and dad, and they're going to cry, 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 cry. They feel that mom and dad have left them there and they're all alone. And the child doesn't understand mom has to work, have other children or whatever, with the mother. So this is a child. Toddlers are hard, but again, the crying is the first stage of a separation anxiety from the parents. Which statement best corresponds to a preschooler's understanding of a hospitalization? Like, why am I in the hospital? So, one of the things about preschoolers, they feel they've done something wrong and they're being punished. I hit my brother, and preschooler is like it's really into this age group. They've done something wrong, God's going to punish them. That something's going to happen to them. So one of the things I do to these young kids say, listen, nothing you did wrong is why you're here. It's because, oh, your appendix, it didn't want to be there anymore. We had to take it out. It had nothing to do with being bad. And actually, that little comment helps these children do much better. I mean, mentally, it does. So the toddler seems more interested in her toys than her parents. What stage of separation anxiety is this? We have the first, the second, and the third, right? We have the protest, screaming, yelling, going bonkers, right? And it could be a couple days worth. And then you get into the point where, I'm going to sit there, regress. I'm going to suck my finger. I might need a diaper again. And then it goes into denial. And this sometimes is when the parents come in, they avoid them and they ignore them. And that's absolutely normal stages of separation anxiety. And as nurses, we can help this child because we know where their minds are and what they're going through. Which roommate would be the most appropriate for a 16-year-old adolescent with cystic fibrosis? Room placement's important in a hospital. We don't have all private rooms. Many of them are semi-private. Yes, you have the private for things that you need, to be separated alone. But, putting a 16-year-old, what's the best one? Well, you don't want anything with an infection because cystic fibrosis, their lungs are very brittle and they can get it. So another medical patient, a diabetic, almost the same age. Perfect, perfect choice. You don't want a younger one. You don't want one's crying. You don't want them to be the big sister. You don't want them to be the parent. You want them to have time to get better too. So parents of a 9-month-old infant ask if their preschool child may visit his younger sibling. What are you going to say? Preschoolers, their little baby brother and sister aren't home and they're worried. They really are. I mean, we're lucky today we have FaceTime, aren't we? Because years ago we didn't have that. So one of the things that we need to do is they need to go in and they need to visit. But as a nurse, you need to tell parents to prepare them. Are they in the ICU? Are there all of these loud monitors? Are there IVs? Are there things on the kid that the child who comes in to visit are going to be upset about? Prepare them properly. And also, remember, preschoolers get a lot of runny noses and little upper viral, type of infections. Make sure that at least they wear a mask, if they have, the mucus or a cough. Got to protect everybody. A hospitalized toddler was drinking from a cup at home, but now refuses to drink from anything but his favorite bottle. Why? Again, a toddler. He's regressing. Remember, toddlers is in a new environment. They're stressed and they do regress when they're stressed. They start sucking their finger again, or sometimes the bottle, or even now one it needs a diaper. Absolutely normal. It's part of that anxiety, that stress. It's expected. A multi. A nurse encourages a school-age child to draw a picture after a painful procedure. Now, why? Now, this is a school-age child, ages 6 to 12. So what you've done is you've distracted this child into thinking about what's going on, how do they feel, and they're making a picture. And now they've expressed to you through a picture, and they don't need words. They can show you the picture. And as a nurse, you're going to say, oh, okay, that's what went on, what they were, upset about, or why it was painful to them. And then maybe if they have to have that again, we can change the way that we do that procedure, make it easier on that kid. When is the best time to begin to prepare a 5-year-old for surgery and the need for hospitalization? I mean, not every surgery needs for them to go in the hospital. We have a lot of outpatient stuff done. I mean, the biggest is tonsils, adenoids, and ear tubes. Those are in and out same day, right? But you don't want to begin too early, but you want to give them enough time to sit back and think about, I'm going to the hospital, I need surgery, and let them talk about it. And if they talk about it, and if we can get that kid into the hospital to look at the equipment, with their nurse practitioner or with Child Life, that is the absolute best thing that we can do. And now they're not going to be afraid, right? Because we know what's going on. And that 4 days gives them enough. You don't want to do it more than that. 4 days is long enough. A 13-year-old girl's been hospitalized for the past week. What do you think this girl's biggest concern is? 13. You're talking adolescence. What do adolescents worry about? That's the way you need to look at that question. Most of all, they're worried because they haven't washed their hair, right? Their appearance. And that is the one thing that drives them crazy. Not that they're separated from their friends and this and that and the whatnot. Remember, it's all about identity. How do I look? And that's the adolescent. So the nurse notices the mother of a child with CP redoes many of the things the nurses does. What would you say to this mother? Why is the mother redoing all that? Remember, the child is cerebral palsy. Cerebral palsy children need a lot of stuff, right? And usually the mother is the one who does those things. And the thing is, mothers do things their way. And it's something that they think is the best way and the child's used to. So one of the things is, tell me, share with me what you're doing so I can do the same things. Because that's what she's showing you, that I like it done this way and you're not. And my kid knows it this way, and I think that's the best way. Because mothers get very possessive of their children, and that's okay. They're taking good care of them. So a toddler cries when I visit. Maybe I should just stay away, the mom says. What's the nurse's best response about that? Again, we're talking about a toddler, aren't we? Toddlers are difficult. age of children, with medical issues. Remember, this is normal. It's part of separation anxiety, isn't it? So it is normal, and the parent needs to know about it because they feel like, oh, my kid don't love me anymore, right? Prepare to collect an admission history from parents who have recently immigrated from Russia. What do you need to keep in mind? And this is all about Russia, culture, and differences in people, right? And these are things you need to remember, that not everybody wants exactly what you want. The way they do things are different. And one of the things about, people from Russia in general is that smiling is inappropriate in a serious situation. And nurses are always smiling, aren't we? Keeping that happy face for them. Well, in this case, this is inappropriate. And how would you know? You would ask, right? Always ask the parents. Which nursing action would facilitate rapport with the child and the child's parents during the admission process? You're coming into a hospital, you have the child and the parents, and you're the nurse trying to get every information you need to take care of them, right? These parents and the children are all stressed and they're very anxious, aren't they? So, as a nurse, if you are going to be there with them, be calm, answer the questions, and if you do it in that manner, you're going to calm down the parents and the child for the entire visit. If you're not like that at first, this child are going to be upset and it's going to continue. You can't, at that point, almost not fix it. So a 4-year-old begins to cry when his mother tells him it's time for his operation. Which particular fear is this? Preschoolers, things like they're afraid of the dark, right? One of the things they're afraid that if they go inside they're cut, that their insides are going to fall out and they're going to bleed, right? This is the age of Band-Aids. So they are afraid of going inside because everything's going to fall out and they're going to die. And that's exactly how they feel. Preschoolers, age 4. How does a preschooler understand the reason for being hospitalized? Where does their mind, again? Like, why do I have to be in a hospital? And if you look at it, it's like, what did I do to make me be punished in a nutshell? So my appendix got sick because I hit my sister. Or my appendix got sick because I didn't take the garbage out. Or I kicked the dog. Or I forgot, whatever. I didn't do something. They always feel they're being punished. What age child has the most difficulty with coping with separation from parents when hospitalized? You know this one now. Toddler. Again, toddler. They want mom and dad there. You're going to see that in many different ways. How do you know the parent understands a hospitalized toddler's need for transitional objects? How do you know they know? Parents. What is a transitional object? They know that there are things, whether it is their stuffy toy from home that they bring. It gives them security. They need something to keep their mind off of what's happening to them. So stuffed animals, and sometimes it's the blanket. I mean, you wouldn't bring an old dirty blanket, but another choice to be made. But that gives them comfort. That gives them a feeling of, okay, I can do this. I got my stuffy toy, right? How would you tell a preschooler when daddy's coming to visit so they understand? How do preschoolers understand time? Again, ages 3 to 6. These children only understand events. After lunch, daddy is coming. They don't understand in 2 hours or at 4 o'clock. They don't get that yet. What advantage of fentanyl for an upcoming procedure will the nurse explain? Fentanyl, that is an opioid. It is used for pain that we do. What is the advantages of it? We use it a lot in the pediatric world. We use it on little tiny 1-pound neonates. I mean, that's how much we use it. It works quick, and it's usually the action for about 1 hour. And because it's rapid onset, it does what it needs to do, and it wears off quickly. And it's extremely potent, but it's been around a long time, so we really know it. It is addicting. It's not long duration. It's designed for all ages, but we use it a lot in children. We really do. The nurse shares the information and timelines recorded on their interdisciplinary outline of care. What is that document? An interdisciplinary outline of care. What does that mean? When back in actually the 1980s, they came out with these needs for giving diagnoses to whatever you're there. And then they determined that there is a recommended way that something should be treated. One of the first one that was treated was cardiac and myocardial infarctions in adults, but it's trickled into the children's world. And it says, this is what you need to do on admission. And then it tells you every day what should be done until discharge. And it's called a clinical pathway, okay? They take it, the doctor signs it and fills in the dosages, and it is a tried and true way of treating patients that we know is the best method. So multi-select. What is the name of an adolescent that has legal rights to sign their own consents? Remember, at 18, cognitively aware, that child will sign their own consent. And that child has to give permission for the parents to know what's going on with them. But we also have adolescents that are not 18 that has legal rights. They can sign their own also. And it's called an emancipated minor. These are younger people than 18 that have the court to sign for whatever reason. And then, of course, any cognitively aware child at 18 will sign their own too. And you have to ask them permission. The nurse is preparing to start an IV on an infant admitted to the pediatric unit. What intervention is appropriate? You have an infant. They need an IV. Well, when you have an infant, parents don't want to leave that infant alone, right? What I'll do is I'll give them a pacifier with a little bit of sugar water, or I'll tell them to breastfeed, and they will get that sucking, because how do infants soothe themselves? It's oral, all oral. They soothe themselves. Get the parents there, let them hold their hands, talk to them, be a part of it. And then they feel like, well, that actually wasn't too bad. And then actually the parents help a lot most of the time. So multi. What are the stages of separation anxiety? I think we've been over it. Backwards, forwards. And I think you could pick them now. So it's all of them but acceptance. Acceptance isn't there. We go through yelling, screaming, then we go through despair and the regression, and then it's denial. All right, mom's not here, it doesn't matter, and just go on with it. Acceptance, no, they never accept that separation anxiety. A multi. What will the nurse include when documenting the discharge of a pediatric patient? What do you need in the chart? What are you going to document? And we know discharge and the instructions and teaching start on admission, right? From the moment you first see that child. So we want to know who is there, what does a kid look like, what time, how are they going home? Is it by bus or by car, right? And then written instructions were given to parents. And if a child is older, I like to give the older child a set of them too, so they can read them. You know, school-age children are alert enough to take care of themselves, and to give it to them too makes them feel important and puts them in charge. And actually, you usually get what you need done better because you gave it to the kid. Oh, multi. What are the basic fears of a young child being hospitalized? I mean, what do kids worry about, basically? The young ones, what do we worry about? They go to the hospital. You know, we talked about preschoolers, we talked about, you know, they're going to bleed to death and band-aids, right? So that's the body intrusion. Separation, absolutely, especially your toddlers, right? And pain. They don't care how much it costs. They don't even know what that is at this time. And last question is a multi. What nursing care would you incorporate when caring for a toddler? You know, I've got a lot of questions on toddlers, and the reason why is these kids are really hard to work with in the hospital, and you really got to build rapport with them and understand, you know, the way that they think. So we need therapeutic care. We need to understand what's going on and be flexible. These kids, you can't rush them into anything, you know, and then of course, teach, you know, if you can't, you have so many people there today in the pediatric world. The Child Life team are amazing, and most pediatric facilities have them now, and they can let them touch and see and feel and understand. And you think 2-year-olds don't understand? They are smart, okay? Let's see how we did. Number 3 is, we got a number, and now we have number 2, DW, and no, we got a lollipop, and KH. Number 4, RC and a K. Is that RC Cola? Anyway, I will be posting this Kahoot recording. I'll also do another recording on chapter 21 so that you have it to listen to it. Very much a lot of interesting stuff there for you to go over. Again, you'll get your exams will be done by tomorrow by around noon. You should have them uploaded into so that you can have them in your grade book. Any questions, comments, concerns?
No, just
Thank you,
exhausted.
guys, and thanks for being patient at the beginning of class. That was like, I wanted to pull my hair out. I know how
Me
you
too.
feel.
I had technical issues